please, while the speakers are on screen and talking, if I would request all participants to please keep your microphones muted to avoid any disturbances. If you have comments, please feel free to put them in the chat, or if you have questions, we will have a session for the questions right at the end. Please raise your hand if there's an issue. And I would now like to request Dr. Saima to please come in and formally start the process and share the agenda with the audience today.
Thank you so much, sir. And welcome, ladies and gentlemen, to this first webinar in the webinar series on first ever digital census of Pakistan 2023, organized by Population Association of Pakistan. Today's webinar will focus on a larger national perspective, with subsequent in this series focusing on provincial perspectives. We are planning to have some provincial webinars in this series too. The run of the show today will be an overview of the context, followed by a panel discussion, and then we will invite questions from the audience. As per the preliminary results of first ever digital population and housing census 2023, Pakistan total population has now reached approximately 249.5 million, or around 25 crore people, with an intercensal growth rate of almost 3%. The primary goal of a census is to accurately count a population during a specific time period, an exercise crucial for appropriate resource allocation, delimitation of electoral constituencies, electoral representation, assessment of living standards, and public and policy planning. An accurate population count is fundamental for sound planning for growth. As we wait the detailed result of the current census, there are several questions that loom larger on the horizons. In today's webinar, we are joined by leading experts to discuss the potential strengths and challenges of the latest population census, discuss potential impact of key challenges on the accuracy of census data, to discuss the implications of data deficiencies for estimating future population, and to discuss the growth in the country and its population growth in the country and its subdivisions, and what does this population figure mean for country's socioeconomic growth. We are really grateful that we are joined by leading expert, Dr. Luay Shabaneh, the country representative, UNFPA, Pakistan, Dr. Naeem-uz-Zafar, Chief Statistician, Pakistan Bureau of Statistics, Dr. Sathar, former President PAP and Country Director, Population Council, Pakistan, Dr. G.M. Arif, former President PAP and ex-Joint Director, Pakistan Institute of Development Economics, Dr. Nasra Shah, President PAP and Professor, Lahore School of Economics, Dr. Aisha Shiraz, Member Executive Council PAP and Director, National Institute of Population Studies. To set the context for today's discussion and to establish why this discussion is so essential, I would like to invite Dr. Luay Shabaneh to provide an overview of Pakistan's population growth and characteristics. Over to you, Dr. Luay Shabaneh.
Assalamu alaikum. Can you hear me?
Yeah, you are audible.
Good morning, everyone, and thank you very much for inviting me for this webinar. And thanks very much for organizing this discussion about the census. This is a very important topic, and it's very good to have this intellectual dialogue around the census development and the consequences of the outcome of the census on the population. As you all know, the situation in Pakistan when it comes to population is characterized by the following mega trends. Of course, the high population growth, the size of the population as the fifth sizable or more populous country globally. But on the other hand, other demographic population dynamics indicators, unfortunately, Pakistan is among the least performing when it is compared to the neighborhood countries but also it leads to performing on gender equality index, for example, globally. Therefore, the census becomes very, very important. I would like to speak and focus my discussion, these 10 minutes, on the situation in Pakistan vis-a-vis the population. First of all, let me speak about the opportunities that Pakistan has. Young population is an opportunity. The brains in the country is an important opportunity. Not many countries around the world are granted with a number of experiences and brains in the country where you can utilize wherever you go, in which branch of science and in which practice that you need. Of course, the anxiety about population is an opportunity, because I do not feel that the population agenda has been taken seriously in a coherent way to try to make an effort to do something concrete around population planning. But in my discussion in the last 7 months since I arrived to Islamabad, and at all levels, there is an anxiety about population, and there is realization that the country will not be able to move and progress without making something on the population front. Of course, unfortunately, the narrative in Pakistan about population is very old. Still, people are speaking about population control, birth control, which is something that has departed the world since a few decades. The discussion now is about human rights. It's about the well-being of the people, the rights of the people to enjoy their basic rights, the free choice of the number of kids that they would want to have. And once they are empowered and able to get good service and good information, then they can do informed decisions, which already fixes the other indicators, as it has shown in a number of countries. Now, what is the challenge on the population agenda? The first challenge is the public management. The public management in Pakistan, when it comes to population agenda, first of all, it is heavy elephant, very heavy elephant, and it lacks the ability to make accountability vis-a-vis the sector. What do I mean by this? The division between the population departments and the health departments doesn't make that population planning is having a quality of accountability on the sector. Every department looks at its own program and its accountability vis-a-vis what they plan. The family planning program in Pakistan needs surgical reform, starting from the services, contraceptives, commodity security, supply chain, ensure that are able to provide all these matters according to the needs of the people all the time. And second, the advocacy needs to have a reach out, targeted, and therefore there is a need to look at this. The second challenge, which is linked to the census as well, is the lack of access to data. There is a very restricted access to the data in Pakistan in general. And this is something that needs to be looked at. In order to be able to make empirical research, people should have access to the microdata. Of course, in most of the countries, There is the concern of confidentiality of the data, but there are ways to handle this. And I have been working as a chief statistician in the old days, more than 20 years ago, and more than 20 years ago, we were providing microdata to the universities for higher graduate schools in order to be able to do empirical research. Otherwise, no, there is no possibility to make causal analysis, no possibility to make composite analysis, logistics, regressions, and all the types of the analysis that are very much needed to push the social agenda could not happen. Therefore, the culture of sharing information and make the data available is extremely important. And most importantly, is to make it available on time. The other issue, which I think you need to think about it and to start discussion about it at different levels, is the over-politicization of the census. It is not very common to have census linked to elections in many countries, because the experience says whenever the census was part of the political process, the census lose, and the credibility of the statistical institute lose, because political issues usually are sorted out in the negotiations. But census is a mathematical thing. It doesn't go with negotiations, and whenever you mix those, it will be misused. And if it loses the credibility, if the statistical office loses the credibility of the people, it will not be able to gather good information afterwards. Therefore, I think the issue of politicization is a real challenge in the country. There is lack, when it comes to the population agenda, there is lack of coherent efforts. If you go and discuss what is the population vision for Punjab and the population vision for Balochistan, they do not speak to each other. The way how Sindh is handling population vision is very different from KP. There should be a national vision for the population, national action plan, and then each province can discuss this. The structural issues needs to be looked at. Now, if you look at the risks that we're having on the population agenda, census is already on risk because of the over-politicization of that. Second, the lack of access to the data will not allow a good customized, targeted plan. We don't have enough data at the district level. We wait from census to census. But the modeling, the availability of the census of the data and using the survey data to do modeling is the only way to produce data at district level so that you can address the issues as it is in the different districts. But having this overall national indicators, it will hide inequalities and it will not help us to do a great plans that could respond to the actual needs. And this will lead also to the lack of the waste of resources, because you plan based on an image which hides a lot of inequalities and a lot of differences across provinces and the district. The final thing which I would like to say, that the population agenda needs to be looked at from also the economic angle and the social angle. Social agenda is not only it's not an important component on the national agenda. Although most of the challenges that the people face is of social origin. Therefore, linkage between the economic and the social agenda is very important. The government is much overwhelmed with the economic agenda, but I feel that social components are very important to move forward. I'll stop here. Thank you very much.
मैं सोचे पाकिस्तान जूम पे मीटिंग अटेंड कर रहा हूँ Census.
Thank you, Dr. Luay Shabaneh. Sorry, I pronounced wrong. Please accept my apology. Now, thank you so much for a comprehensive overview of Pakistan's population. Now, I would like to request our first panelist, Dr. Naeem-uz-Zafar. Is he here?
Yes, I'm here. I can listen. I can see. Yep. I'm here. Can you hear me?
Dr. Zafar, I can hear you loud and clear. I'm sure the other folks as well. Maybe Dr. Sama's end is, we can certainly start.
We can hear you loud and clear.
So I would request Dr. Naeem-uz-Zafar to provide us with an overview.
Sama, I lost your sound.
Dr. Naeem-uz-Zafar, I'll jump in. I think Dr. Sama's internet is wavering. Please, sir, the floor is yours. Please go ahead, sir.
So am I supposed to talk on some specific aspect or?
Sir, we are hoping you could share with us the experience of the census.
Okay.
What your experience was in leading this exercise, sir.
Okay, that's first of all, thanks a lot for providing me this opportunity to talk to such an august forum in which I can see the leading demographers, practitioners, academicians, NGOs. So before sharing my experience on this digital census, for which we are just done with the completion of field work, I would prefer to comment on few issues which Dr. Luay used in setting the context. First of all, I totally agree with him. I would rather prefer to add on what he kind of started, but he did not delve in detail, that population management is a social issue. So unless this lack of appreciation persists at the provincial level, at federal level, working alone from the supply side, from CPR or other procedures, reversible or irreversible, that is not going to help much. So unless this is realized by all provincial governments, that it has to be embedded in education, it has to be embedded, integrated with health, it has to be integrated with livelihood, with family decision, which affect people's choice of fertility, of having the family size, when to start, how long to delay. It's a social issue. So merely putting money by treating population management as a separate sector has not helped much Pakistan. So to some extent, working from the supply side may help, but unless the demand side is worked and real investment is made in the social sector, especially health and education, which will enable a female and also the male who will be the potential spouse of that female to make the right family choices and right decisions, this issue is not going to be resolved. That's first thing. Second thing, Dr. Luay, you said about the access of data. I think I should, those who have been practitioner of microdata know it, that we have made available the microdata of all socioeconomic surveys we do on PBS website. Of course, after anonymizing them, we cannot disclose the identity, but all the microdata which has been approved, the latest PSLM, latest LFS, latest demographic survey, the microdata is available, and we are not doing like other NSOs in which you have to register yourself and record a request before you are given access to data. Very frankly, PBS has been very generous in giving the data, and that's been going on for more than 5 or I would say 6-7 years since PBS made access to microdata available for everyone. So now you don't have to need to fill the voucher for National Bank and Challan form and send it to us. All you need to do is go on website and download the microdata. That's first thing. Now, I would briefly talk about the experiences we have in the census. It started in end of September 2021, when we started to plan for conduct of this digital census. So we had to do it digital. Now, there were several design issues. First of all, we had to ensure that this data should be secured. The way it is collected, transmitted to whatever system, and later we decided that it should be telcos. So transmission to telcos, and from telcos to safe server, that has to be done in a very secured manner so that the information is not disclosed. No one can take this information away. So that was the first thing, the design aspect. Second thing, those who have been aware of the census history know that 2000 census was approved with significant delay and a lot of deliberation, and there were reservations from province of Sindh. So it was necessary to ensure that the progress of census should be visible to all stakeholders. So a system had to be devised which should share information, almost real-time based, GIS-based information of census progress to stakeholders. And the second thing which was ensured, that not only they should be able to see the progress, but if some correction is to be needed, some under enumeration, some correction has to be made, that they should be able to communicate with us amongst ourselves, with the enumerators, so that the timely action may be taken instead of knowing about the issues and errors after completion of the field work. So these were the few design aspects which were in consideration when we started the planning. So we embarked on the planning, and then there was a huge task of developing the software. We called it ERP. 16 modules were developed. Some were related with the listing, some were related with the enumeration, some were related with the human resource deployment, some were related with creating some identification between the block, between the enumerator, between the tablet, so that the person can be tracked, progress of that person can be tracked with some unique identity. So that was also part of ERP system. Then there were other host of things which I will not drag you in detail. They may not be so interesting to you. Then the huge step was to procure 126,000 tablets. That became also problematic because of the economic situation, which started almost in second quarter of 2022, and they have gotten aggravated on one account or another. First flood, then economic crisis, then IMF, and the economic problems are still not over. So we faced tremendous problem in securing the tablets. Then the next step was to do the pilot, to have some idea about the time and enumerator will take in to complete a block, because that was the basis of designing the whole system, that how many enumerators will enumerate 186,000 plus blocks in 1 month or little more. So we arrived at certain numbers, and that became the basis of planning that how long we will stay in the field and how many enumerators we need. So once we had clarity from the pilot census, which we conducted in July 2022, we started establishing a system, a sense of census support centers at Tehsil level, which is the sub-district level in Pakistan. Folks who are aware of the census process know that the census forms were distributed to assistant commissioners at Tehsil level, along with the maps, and the forms and the maps were distributed to supervisors and enumerators in the respective tehsils. And then they were escorted by security, and then they enumerated their respective blocks, listing, and followed by enumeration. And then the forms were collected back to Assistant Commissioner Office, and then they were arranged according to the blocks and charges and circles and tehsil, and then there was a huge logistic operation of sending those forms back to headquarters, where we scanned those forms and started the tabulation and tried to come up with the preliminary result. So that's what which happened in 2017 census and earlier census. But this time, those whole steps were dispensed with because data was collected digitally and reposited in the server. However, still the dispatch of tablets to Census Support Center has to be done. The troubleshooting with the software and hardware and the connectivity had to be done. Some training needs, if need be, that had to be done. So the minimum human resource had to be provided at Census Support Centers. So in the third quarter of 2022, another humongous task was to establish Census Support Center in almost 500 tehsils of Pakistan across length and breadth of the whole country, and we did it. And it should be mentioned that prior to that, we procured the necessary IT and the sitting requirement and paraphernalia which is needed to make that office functional. So those offices were human resource staff, provided IT, provided connectivity, some bare minimum things, and they were made under the auspices of Assistant Commissioner. Then in December, last quarter of 2022, we embarked on a training of, it was a 3-tier training, and it started from imparting training to Pakistan Bureau of Statistics officials, the officials from provincial bureaus, senior officials from the departments which provincial government shared with us, which had some experience of doing census. So we gave them training of master trainer. Almost 300 people were trained in a month in December at Nibaf by Pakistan Bureau of Statistics. And in turn, these 300 people went to divisional level at 72 locations and trained almost 3,000 people at divisional level, who subsequently trained 121,000 enumerators and supervisors at tehsil level. So this exercise was completed in almost 2.5 months. And by February, we were done with the training of enumerators. I think in February 22, 20th February, we opened the online enumeration, self-enumeration facility. Although we advertised, but we have been accused and people raised observation that we have not been good enough to make people aware of this facility. Well, we can say that in Pakistan, the social sensitivity of people is not so much. They are more sensitized towards other things, and these things are not taken the way they might have been taken. Second, over the last 4 or 5 months, there has been so much uncertainty and upheavals, social upheavals of one sort or another, that the positive things are almost muted, fizzled out. So it's really hard to get message across. Anyhow, from 1st March, we went into field enumeration, first listing, followed by enumeration. And in the original plan, the process was supposed to be completed by 4th April, but then we had to give 5 extensions invariably by the demand of provincial governments. First Sindh, then followed by Punjab. And in Sindh, they had concerns that many areas or blocks have not been enumerated, or high rises or the places which are difficult to access have not been properly visited, or partially enumerated, partially listed. So there were a host of complaints from stakeholders, political stakeholders, government, and we addressed to all of their issues, concerns, and we ensured, in fact, most of our PBS staff, they were available in Karachi and other areas of Sindh for almost a month. And this was not the case with any other part of Pakistan. So anyhow, we completed, we had to stay in the field till 22nd May. We had to keep system operational. 22nd May was the day when we stopped the field operation. And by then, the count was almost 250 million, registering a growth of almost 3%. Now, this is much bigger, and the population growth rate has risen compared to 2017 census, which is a concern for us. It raises many social issues. It raises per capita GDP, economic issues also. It pushes Pakistan from lower middle income country to the lower notch, which is not good. But very recently, we have been directed by Prime Minister Office to do the post enumeration. Before that, we were trying to do some desk work of analysis using the census data, using the GIS information, and those sort of things to see, to know the extent of over or under enumeration in Pakistan. And we have idea, but to make it more fair and more transparent, the Prime Minister Office has directed us to go for post enumeration. So we are in the planning of that post enumeration. Hope we'll do it by next week, mid of next week, and then we'll go to government again and seek their approval for implementing the post enumeration exercise. So now, as far as learning is concerned, I mean, PBS is a technical organization, and fine, there have been issues and we'll resolve them. But very honestly, it should go. It is a big credit for all the officers who have been working tirelessly that this exercise is totally indigenously designed. We, from concept to conduct, it is PBS. So of course, good and bad, all credits will also go to us. But this is from my side. Thank you.